Hey guys, my name is Tony Mikla. I'm a physical therapist, and the goal of this little video is to show you some things you can do after your knee surgery in an acute situation. We know that at first with this, it's going to be fairly painful. Maybe you're in a brace, you've got some stuff going on. The goal of these exercises I'm going to show you is just to help reduce that pain and start to get you a little bit of movement in your leg. Now, it's really important. Usually the easier you move, and once you break through that first bit of movement, your body starts to feel better and it relaxes. There's a tremendous amount of tension that's held after surgery, after trauma. So we want to make sure that starts to loosen up. So that's really the goal of these exercises. These should not be forcing you into uncomfortable positions. They shouldn't be making you feel worse. So if anything makes you hurt more or anything hurts, then skip it. And then when you go back and talk with the doctor or you come and see a PT, we'll escort you through it and find the best options for you. So don't feel like you have to do all this stuff. But this is a guide and some helpful tips, hopefully, to help you get through this and really have a great outcome. We know that the earlier you move with less pain, the better we do long term. So that's our whole objective here. So let me take you through a couple examples. So we're going to start. First thing you need is just a place to sit. So if you have kind of a high seat is good, or like a firm chair works well, or off the edge of the bed can be a good option for you at home. So typically your leg's going to be fairly straight like this. So let's say that this right leg is my involved leg, or my injured leg, my surgical leg. I'm going to have my left leg, my healthy leg, help it out. So I'm going to put some support under like so. And the goal is to let your leg start to bend. So all we're going to do is let gravity be the driver here. We're going to let gravity just basically pull the leg down nice and easily, nice and relaxed, right? So if we're sitting like this, just have your knee just off the edge of the bed, and then just use your left one to support it and gently lower that leg down, okay? And then whatever it allows you to bend. If you can bend it all the way down so it hangs freely, that's perfect. If you can only let it go a couple degrees, that's just fine. Start with that, right? And just do whatever motion you're comfortable with, and you can kind of rock back and forth here. But I find using gravity is a great tool to allow this to kind of work on just letting some bend happen and let it happen freely. So that's an easy one to get started with. Remember, if this is my involved leg or my surgical leg, I'm going to support that with my other leg. So I have some nice support there with it. Okay. Another way to get a little bit of bend is to do a heel slide. So this, I think our best option is to do it in sitting usually. So this time you need a chair that's on the ground. So in this case, let's keep it the same. So my right leg will be my involved leg. So I'm going to have a surface here that's slippery. So this can be done on a wooden floor or a tile floor or linoleum, any kind of floor you have that has some slickness to it. And then you're basically going to take a towel, set that towel down, and then your foot just sits on top of it, okay? Now with the towel, you can pull on it, and as you pull on it, it's going to bend your leg, right? Then you can either push it back out straight, or you could use your other leg to push it back out straight, and then pull it back again, okay? Now, our goal is not to get it to bend all the way here on this very first part. This is just to introduce some movement. So if you can only get it to bend, like 60 degrees or so, that's great. And then just assist it back out and just get it to move a little bit back and forth where it's not quite so uncomfortable. We know at the beginning it's going to be really difficult to start the movement, but once you get it going, we find that usually it does quite well. So with both these exercises, you could choose either one or do both, whatever you like. And just think of reps of maybe 10 or 15 reps, but probably more importantly, maybe spend 2 or 3 minutes doing it, where you kind of encourage a little bit of motion and get it moving freely. It's not about did I do 50 reps or did I do 10 or 5, but rather did you get your leg to loosen up a little bit? Did it feel a little bit better as you went along? That's the objective. Okay, so now we're going to do one more exercise that's based on flexibility or stretching or motion, and we're going to start to work on getting your leg straighter. So usually after surgery, you kind of feel comfortable to have your knee be a bit bent. We're going to ask you to kind of work on getting it a bit straighter. So you could sit on a bed. You could lay down on your bed. You could have both legs on the bed if you like. But in this case, I just really want you to be here. Toe kind of pointed up towards the sky as best you can. A little bit out to the side's okay. And I want you just to reach forward towards your toes. What you should be feeling is a pull either right underneath behind the knee and then up into this hamstring up behind the thigh. I don't really want it to tingle or pull down into the foot, so that's not a good thing if that happens. Just skip this if that's the case. But if you're feeling a stretch behind the knee and up the thigh, that's what we're looking for. And then just hold this. breathe here and hold this for 30 seconds to a minute. So give yourself a little bit of time. And then you can relax, bring it back down, let it rest, and then you can repeat that again. So a couple bouts of a 30-second stretch works really well here, right? We're just trying to get that backside to loosen up. All right, last one. Okay, this last one, you're going to take a towel. This is about the size of a hand towel. You can use a beach towel if you want. It's not a big deal. What you're going to do is put the towel down in a roll, and we want it right underneath your knee. So it's going to be underneath your knee here. Now, in this case, usually you want to lean back a little bit because most people can't be up vertical. So just lean back a little bit. You can even lay down and do it. I want you to squeeze that towel. So you're going to take your knee and you're going to try to squeeze your muscle, squeeze your quad, and push down into the towel. Okay? So the goal is to push into the towel in an effort to basically lift your heel up off of the table or off of the bed. So if the bed's really soft, this is difficult to do. It's okay. Just you can still use a soft bed, but you're not going to get your heel off at first. Something a little firmer is easier, but don't let that worry you. The big thing is little towel underneath your knee and pushing down into that towel. You want to see this muscle squeeze a little bit, right? So at first that's going to be tough. You'll see your kneecap will kind of pull and tug a little bit. That's very good, totally normal. This is not a risk for you. Even if this is a little bit painful, this is not risky or dangerous for you. So we want you just to do a squeeze and get that quad to start to fire. This is one of your keys to being able to put weight on your leg and feeling stable again to get that quad to turn on. So squeeze, hold it 3 seconds, and then relax, and then repeat it again. So you might do 10 or 15 reps of holding it 3 seconds for each repetition. Okay, so that gives you 4 things or so to work with on the knee. Remember, you don't have to do all of these. You could just pick a couple that you feel good about and that you like. The goal here is pain reduction, not more pain. So if you're having more pain with them, then skip it. And we'll talk to the doc, talk to your PT when you get back in the office, and they'll take you through the next steps. But my hope is that this gives you some solutions and some options to start working on your early range of motion and getting your pain to be reduced so that you can have a better outcome overall.